Hello everyone, this is Dr. Kalpana and you're watching my YouTube channel Pharmacy Lessons Made Easy. We have started preparing for the GPAT exam and today is the dose 11 for the same preparation. So for today we shall be discussing more about antidepressants, the main and important points about depression. So it is actually a feeling of guilt, tension and suicidal thoughts. Okay, so basically the two enzymes or the neurotransmitters, if we talk about the biochemistry of depression, biochemically the two main neurotransmitters which are responsible for depression are noradrenaline and serotonin. So these are the neurotransmitters. The main neurotransmitters are dopamine, noradrenaline, and serotonin. Noradrenaline or norepinephrine is responsible for stress response. Chemical metabolizes the body for action. It increases the blood pressure. That is the main action for norepinephrine. If we talk about dopamine, so it is a reward chemical. It mediates motivation and desire. It is highly addictive. Okay, dopamine is highly addictive. If we talk about serotonin, this is also called love chemical. It brings well-being and happiness. It regulates the mood, appetite, and our sleep pattern, right? So, in case of depression, the main major neurotransmitters which got decreased are noradrenaline or norepinephrine and serotonin or 5-hydroxytryptamine. So the drugs, if we focus on the treatment options which are available, are selective serotonin reuptake inhibitors, that is citalopram, fluoxetine, fluoxamine, paroxetine, and sertraline. So you have to remember this classification by using any mnemonic that you will be able to learn in a better way, right? So that will be more helpful for you. For the case of selective serotonin reuptake inhibitors, you can remember it as SIR 2F Sitapur. Okay, so that means sertraline, fluoxetine, fluoxamine, citalopram, paroxetine. So that way you can add more options also. And you have to actually remember these names with the help of mnemonics. The same way you can find the most comfortable one for you for the other categories also. If we talk about selective epinephrine reuptake inhibitors, so they are duloxetine, venlafaxine, desvenlafaxine, and minaceparam, right? If we talk about the third category, that is serotonin reuptake receptor antagonists, so they are metrazapine, nefazone, trazodone, atomoxine, bupropion, and mianserin, right? The fourth category is monoamine oxidase inhibitors. They include phenelzine, seleglin, prenylcypromine, mocoblamide. If we talk about tricyclic antidepressants, this is a major category which has been used since years. So that is basically can be divided into noradrenaline and 5-hydroxytryptamine reuptake inhibitor and selective serotonin and norepinephrine reuptake inhibitors. The noradrenaline and 5-hydroxytryptamine reuptake inhibitor include imipramine, amitriptyline, trimipramine, doxepin, clomipramine. Whereas noradrenaline reuptake inhibitor include desipramine. This is actually the demethylated product of imipramine. Imipramine once will get demethylated will be converted into desipramine and nortriptyline. So nortriptyline is actually obtained from amitriptyline by demethylation reaction, right? So this is how they are interrelated and show their pharmacological actions. The typical antidepressants are trazodone and mianserin. If we talk about the CNS or you can say pharmacological actions of these antidepressants, so for normal people there is no elevation of mood in the case of CNS effect, and for the depression patient they start taking interest in the life. If we talk about their effect on autonomic nervous system for antidepressants, they are actually having anticholinergic activity. They are anticholinergics and alpha adrenergic blockers, right? So because of this anticholinergic effect, this is the most common with the tricyclic antidepressants is they will feel dry mouth, constipation, and urinary retention. Okay, so this is how they will be affected. And in case of, uh, if we talk about the third effect, that is on your cardiovascular system, the third effect, cardiovascular system, because of this alpha adrenergic effect, they will show vasodilation. So this vasodilation will actually produce postural hypotension and reflex tachycardia. And on, if we talk about lithium, lithium is actually should not be used when plasma levels can be monitored regularly, as lithium has low margin of safety, right? So another side effect which is associated with tricyclic antidepressants other than this anticholinergic effect is increase in appetite and weight gain. This is more common with tricyclic antidepressant drugs. Okay, so if we talk about the side effects with selective serotonin reuptake inhibitors, selective serotonin reuptake inhibitors will show lag time of 2 to 4 weeks. They are quite different from non-selective reuptake inhibitors, and they will have less sleep. Okay, so sedation effect will be less. They will also show the alpha blocking action. They will actually be different from the other antidepressant in the way they will lack this effect of alpha adrenergic blockers. So that means they will not show any symptom of postural hypotension. They are commonly they will commonly interfere with the ejaculation. So orgasm may be a problem for the patients which are associated with depression. Okay, the drug trazodone, this drug trazodone is actually suitable for seizures associated with depression, which are associated with depression. So it's a tragedy that those patients which were depressed were also having the symptoms of seizures. So to treat that tragic, we usually give trazodone. Okay. So this is actually the important point among the antidepressants. So that's why I'm mentioning it here. The drug that we discussed is mianserin. Okay, mianserin. This drug actually blocked the presynaptic alpha 2 receptors. It blocked the alpha 2 receptors, presynaptic alpha 2 receptor. It also blocks 5 hydroxytryptamine, that is serotonin 2 receptor, 5 hydroxytryptamine 1C receptor, and H1 receptor. It blocks. Okay, mianserin. This do not either affect noradrenaline or serotonin uptake. Okay, so that means it is not responsible. So related to both these drugs, trazodone as well as mianserin, previous question has been asked in your GATE or GPAT exam. Okay, so that means it is important to discuss this. At bedtime, we give imipramine for those patients which are actually suffering from enuresis, or you can say nocturnal enuresis. Okay. If we talk about your obsessive, compulsive, and psychotic state, then the drug of choice will be selective serotonin reuptake inhibitors for obsessive patients. Okay, so the acute manic episodes or psychosis in bipolar disorders will be treated with lithium. Okay, and one thing I need to mention here is the monoamino oxidase inhibitors. Basically, monoamino oxidase inhibitors are either MAO A or B. That means monoamine oxidase inhibitor A or B. So monoamine oxidase inhibitor A deaminates 5-hydroxytryptamine and noradrenaline, and and noradrenaline or serotonin. This one is serotonin also. The neurotransmitters which are actually responsible for depression. So monoamino oxidase A is actually inhibiting responsible for this, and monoamino oxidase B deaminates phenylethylamine. Right, so we must know this fact. Okay, and this enzyme, monoamino oxidase enzyme, will be inhibited by chlorgyrin and mocoblamide. And monoamine oxidase B is actually inhibited by selegalin. Okay, selegalin. And the drug interaction that is very much important in case of monoamines is the cheese reaction. That means those patients who are actually taking antidepressants, okay, they should not take large quantity of tyramine containing foods like cheese, protein, cheese, beer, meat, fish, etc. when we take monoamine oxidase inhibitors. So simultaneously monoamine oxidase inhibitors and the protein products or cheese products should be avoided, because that may lead to hypertensive crisis. So this is very important, and this question has also been asked in the previous exams of GATE. Okay, so this is all about the antidepressants, monoamino oxidase inhibitors, tricyclic antidepressants, and all other categories of antidepressants. The most important drugs as well as their facts, their classification has been discussed. So you can write if any query you have in the comment section. You can subscribe my channel, you can share it on the social media, you can share it with your friends. Thank you. Have a nice day.